Good evening and welcome to Quorum. This is our 34th season of providing you a direct link to your state legislators. I'm Stephen Caranda. Mississippi tax collections continue to fall short of expectations. Revenue numbers that were reported for January show the state collected about $24 million below what was expected. Tonight, leaders of the Public Health and Medicaid committees will talk about how this continuing shortfall in funds will impact Mississippi's children, elderly, and disabled. We welcome to the program Senator Hob Bryan, who is chairman of the Public Health and Welfare Committee. He's serving his 26th year as a lawmaker. Senator Bryan is from Amory and represents District 7, which includes Itawamba, Lee, and Monroe counties. Also with us is Senator Briggs Hobson. Senator Hobson is a member of the Public Health and Welfare Committee. He's from Vicksburg and represents District 23 in Issaquena, Warren, and Yazoo counties. Senator Hobson is serving his second year in the legislature. From the House, we have Representative Steve Holland, chairman of the House Public Health and Human Services Committee. Representative Holland is from Plantersville and represents District 16 in Lee County. He's serving his 26th year in the legislature. Also, Representative Dirk Dito, serving his 13th year in the legislature. 14th, he's chairman of the House Medicaid Committee. Representative Dito is from Perkinston, representing District 93 in Forest, Hancock, Harrison, Lamar, Pearl River, and Stone counties. And welcome to all of you this evening. For 34 years, your phone calls have been an important part of our program. The toll-free number from anywhere in Mississippi is 1-877-405-5247. That's 1-877-405-5247. You may begin calling us with your questions for our guests. For those of you on the internet, you can email your questions to quorum@mpbonline.org. Also, tonight's Quorum is being simulcast on MPB radio. To get us off tonight, I'd like to start with something that's not necessarily related to health care, but did happen today in the Senate. They reconsidered a voter ID bill, removing an exemption for people born before 1946. Under the bill, voters would need to show a photo ID at the polls. To you, Senator Bryan, what are your thoughts on the change in the voter ID legislation that your House, or your chamber rather, is working on right now?
Well, I'd rather talk about the budget, or I'd rather talk about public health, because we've talked about voter ID forever, and it's an extremely frustrating proposition for this reason. There are people of goodwill who believe that there are a number of repeat voters who vote over and over again with different identities at different places. There are those of us who believe this just does not happen, that if it happens, there ought to be evidence of it. And we think this is sort of like looking for the abominable snowman. We hear about it a lot, but we never see concrete examples of it. So it's a debate where people of goodwill have such differing views about what's going on in the real world that it's frustrating. And of course, I think all of us understand the critical importance of the right to vote, and would hate to be in a situation where an eligible voter showed up and for one reason or another was not allowed to vote because he didn't have an ID. It's that friction that leads us to continue to vote on this issue over and over, and that's why it's so hard to resolve. It's very frustrating, but yes, we debated it again today. And we can all make each other's speeches. We've debated it so much. All the folks on both sides can make the speeches for the folks on the other side.
They've memorized them all.
Just about.
Senator Hobson, how about yourself? What's your thoughts on the bill that's making its way through?
Sure. One of the things, when I ran for this office, one of the things that I heard repeatedly is that we need some form of voter identification. I think there are a lot of people that feel like there are flaws in the system, and of course you've seen with the Wilkinson County lawsuit, and you've seen in other instances in Mississippi, not to mention other states, that we've had issues with there being concerns about the way elections are conducted. And I think voter identification is one way that we can make our elections safer. You know, the amendment that had come up and that was actually passed and then rescinded today was an amendment to increase or allow persons over 65 years or older not to show identification. The concern that I have with that is that I'm afraid that the elderly would be the ones who are getting preyed upon, and people would take advantage of those that may not get out and cast their votes. So I had concerns about leaving in that exemption for persons over 65. As Senator Bryan said, it's you know, good people have differing opinions on that issue, and I was grateful and happy today to see us go back to what we had originally proposed in the Senate, and that was to have some form of voter identification for our citizens.
And Representative Holland, this is something that, of course, the House has considered in previous years, and I think there's some legislation still maybe being considered. What is your opinion on what the Senate has worked on so far?
Well, I don't know what the Senate did today because we were working in the House, and I'll hear about that when it comes from the Senate, when that deadline comes. But I can tell you this, I do think the House finally is poised to pass some kind of voter ID. I think we will differ a good bit from what the Senate has done. We basically in the House are a larger body that represents theoretically more of the people, closer to the people. And voter ID to a lot of members of the House is much akin to building a fence to keep livestock in. We don't think fences should be built around the polling places, really. Having said that, the train's left the station. So I think we'll have some kind of voter ID. I don't think it will include a photo. I do think it will include early registration and voting. And there's going to be some differences there. And as we always do, I hope that we can put this issue behind us. It's sort of a wedge issue. I hope we can compromise it, and I hope we can move on to some of the more serious issues.
Representative Dito, just to wrap up, your thoughts on the voter ID issue?
We have a bill on the House calendar that is based on elements of the surrounding states, Tennessee, Arkansas, and Alabama. That measure is to be voted on within the next week and a half, and we anticipate to have a position on that very shortly.
Another thing that...
Stephen, just quickly, I don't mean to monopolize this, but one of the concerns is that in some versions of the bill, if you did not have a valid photo ID, you would not be allowed to vote, even though there was no question about your identity. In the last election, there were some students from Notre Dame who showed up to vote in Indiana, and they were not permitted to vote because their student IDs, which they had, were not issued by the government. They were issued by the University of Notre Dame, which was a private institution. So there are situations like that. My father's driver's license expired a couple of years ago around Election Day, and he failed to get it renewed, and after the election mentioned that to me, and it dawned on me that under the versions of the bill that were being considered, because my father's driver's license was expired, he would not have been able to vote for me in the last election, leading some of my colleagues to ask what makes you think your father was voting for you in the first place, and I didn't have a good response to that. But seriously, those are the serious concerns that some of us have, and it's not quite as simple as it seems at first blush.
Well, and my grandmother never drove anything but a pair of mules, and you don't have to have a license from the Mississippi Department of Public Safety for that. So, yeah, it's a bigger issue than just voter ID, but I'm confident this is one that we're going to resolve this year and get behind us. I don't think anybody's going to like the finished product totally and be completely satisfied, but I think we can call it voter ID, and I think it will be some kind of system that will bring fairness to these unfair elections that we've had for so many decades in Mississippi.
Sounds like still some work to be done on that issue. Another thing that happened today, the state children's health insurance program was reauthorized and expanded. President Obama signed it. SCHIP, for those who don't know, provides health care for children whose families make too much to qualify for Medicaid. Representative Dito, what impact does the SCHIP program have here in Mississippi? How close are you watching that, chairing the Medicaid committee?
The Mississippi CHIP program is very important. Children whose families make too much to be eligible to be on Medicaid, but they're still really the working poor, those children are eligible for the state child health insurance program. Provides health insurance to about 66,000 children in Mississippi. The federal program that has just been reauthorized. We're very anxious that it would provide more funding for our state program. But something that also happened today is that the nominee for the Secretary of Health and Human Services at the federal level withdrew his name from the nomination process. And so they have to start over with a new recommendation, and that setback in the confirmation process in the United States Senate could really delay some of the federal health insurance reforms that we're really looking for immediately.
And Representative Holland, how much of an impact do you think this is going to have here in Mississippi? It's a bill, it's a program that the governor has argued in the past hasn't been funded enough initially to cover all of our children here in Mississippi.
How in God's name can anybody in this state be against the children, especially the children that might get sick? You know, what we've got to learn is we've got to do preventive things in this state. And one of the ways to do that is to beef up all of our programs that deal with the health and education of our children. Better than 50% of the children in the state of Mississippi live in poverty. They need health insurance. I am 100% for any increase in health insurance, and furthermore, you know, the current administration that we're in 2005 did not even renew a $1 million free Robert Wood Johnson contract that would allow outreach to bring our children in. We have children right now in this state that are eligible that are not here because there are not many programs other than some church programs and a few advocacy groups like Children's Defense Fund that are out there trying to get people to sign up. But you can't say no to S-chip. It's just not the right thing to do. It's good progressive legislation that makes a healthy child who can learn because a sick child can't learn. It's preventive in nature. It will cost us much less over the long run, and we can raise some healthy adults, hopefully, who are intelligent.
Senator Bryan, how close have you and your committee been watching the S-chip legislation?
Well, I think, Stephen, S-chip is part of a bigger picture, and you sort of have to take the healthcare system that we have, which is beyond the ability of any of us to change in many respects, and work within that. The way that we provide health insurance and health care to people who have no money at all is that they show up at the hospital emergency room and get some sort of treatment. And the hospitals just have to eat the cost of the people that show up at the emergency room. We provide care to folks. Almost every physician, I think, and other healthcare providers, to some extent, provide uncompensated care to take care of people. If that's the way we had of feeding the poor could walk into a grocery store and pick up food and just go to the checkout counter and say, "I'm sorry, I can't pay for it," and leave. You would observe bizarre things happening in where grocery stores are located and how they do their business. And that's sort of the way that healthcare works. Well, in Mississippi, we have an unusual situation in that with both our Medicaid program and our Medicare program, our S-chip program, Medicaid and S-chip, we have an incredible federal match. With Medicaid, we put up a quarter to get $1 worth of health care from the Medicaid program. With S-chip, the match is even better, and with the legislation being considered in Congress for the next couple of years, it's even going to be a more favorable match than that. So what that means is we can have a system where, in various ways, health care is paid for either by other folks who use the emergency room who have health insurance, or health care is paid for by tax dollars from cities and states and the counties, which is 100% local money. Or we can use Medicaid and we can use S-chip and we can provide health care for about 20 cents on the dollar. And I'm saying that's a more rational way to provide health care for the poor than the alternative. And Mississippi needs to take advantage of that extraordinary match that we have.
Representative Dito just mentioned about how presidential appointments, or lack of them at this point, some of them are affecting this sort of legislation. What do we need to be watching here now that this bill has been signed, and how's it going to play out when it affects the state here?
Well, I think that all concerned thought that Senator Daschle had a great deal of understanding of the healthcare system in the United States. And, Steve and I have been dealing with this because we got elected, 24 years ago?
27.
And, well, you're better at math than I am, but you're on appropriations, I'm not, so I don't have to know that. But we learn over and over, the more we deal with it, just how complex and how many moving parts there are to the system. Senator Daschle had comprehensive knowledge of that. He had gravitas. He was respected by people on both sides of the aisle, with people in Washington. And it's most unfortunate that things have developed that Senator Daschle is not there to lead this effort. We have the world that exists now, which we can talk about later, I hope, with some bizarre features. And we can imagine an alternative which would improve some of those bizarre features. But it's mighty difficult to get from where we are now to where we'd like to be, even though there might be a consensus about getting to this alternative system. because everybody's got some advantage in the current system, and nobody wants to turn loose of the advantage he perceives to have now for the promise of something that might work better, and it's very, very difficult.
I think we've got a caller. I hope I'm getting this right. Huey from Learn It. Go ahead.
Yes, sir, that's right.
Go ahead with your question.
I was wondering, the legislatures are meeting up there discussing the budget. Why can't they balance that budget up there? All they've got to do is cut salaries statewide. The little school down on 49, they have already done their stuff down there to balance their budget. That's not a big problem. We're in some bad financial conditions across this country, and they need to prepare for it as they go along, not wait until they get broke before they start.
I think we've got it there, Huey. As a member of the Joint Legislative Budget Committee, Representative Holland, what are your thoughts on what Huey has to say about it, the cutting the budget here in Mississippi?
Well, Huey's got the Constitution on his side. We have to balance the budget in this state, and we will before we leave April the 3rd or 5th or whenever we get out of this dismal situation that we're in. But it's a process that we go through. I'm passionate about health care. I'm passionate about the children. I'm passionate about the elderly. I'm passionate about a lot of things, the arts, all kinds of things. There are 174 members of the legislature that come from varying backgrounds, that have varying specialties and varying interests that they bring here. And it is really a true marketplace of ideas and a laboratory of democracy. And I think that once we go through, this is Senator Bryan and I in our 26th session. Some years I've sat through this thing and I went, it's just not going to work this year. But it has. And then we opened our session in the old Capitol, and I got to thinking all the way back to 1839, statehood 1817. It's worked every year, Huey. And it's going to work this year. It's just a matter of how we do it. It's not easy as just saying that we should do it, and we respect the fact that there are a lot of people out there that give us a lot of ideas, and we accept those and take them on their face value. And I listen, and I will listen to you who wants the budget balance. But I don't like schools cut, for example. I don't want the sick thrown out like they were thrown out 5 years ago when we had the Plaid situation. I don't want Katie Beckett children, disabled children at home, getting half a therapy instead of a whole therapy because they're sick and they need all their therapies. Those are the things I fight for. And at the end, we bring it all together, and it works. And it's going to work this year.
And Senator Hobson, being somewhat new here, when you first came to the legislature, is dealing with these budget issues as easy as Huey seems to think it could be?
Well, I agree with what Representative Holland said, and you've got different members of the legislature that have somewhat competing interests as to how we should fund the government operations. And there's only a certain number of dollars that we're taking in, and there's so many needs out there, and it's the fight that we have on a daily basis to determine what are the priorities. We have to set priorities, and I'm sure each of us ran on platforms of what was important to us, and I think we all try to espouse the beliefs that we have and convey any arguments that we have about why those particular areas should be funded properly. It's frustrating for me as a relatively new member of the legislature to be here in this year when we've got very little money. In fact, I would say we probably all agree that we're looking closely at what the federal government does. The Obama administration has come in and said they're going to have a pretty expansive bailout, if you will, and we're wondering and waiting to see what happens there because it may dictate some of the things that we do here in Jackson.
And one of the things that has been going on here in Jackson, looking at ways to deal with the budget, is the possibility of increasing the tobacco tax. The last week, the Senate, of course, passed a 49-cent tobacco tax increase with money going to offset car tag costs. The bill's author, Senate Finance Committee Chair Dean Kirby of Pearl, had this to say about the legislation on the Senate floor.
Now, let me tell you the things that can happen. First thing that can happen is if you raise the cigarette tax to $1, which the House had, or anything much above what this average is, not only are you going to have people from Mississippi going out across the border, and if you think about the people in DeSoto County, Tishomingo County, down to Meridian, the Gulf Coast, those people in Picayune, as an example, running over to Louisiana, and then all the way over from people even in Jackson going to Vicksburg and going across the river and buying. We're talking about losing a lot of money. Now, I understand Senator Horn asked me a question yesterday. Now, he said, is this bill for us to help as far as health issues and making people quit smoking, or is it to raise revenue? And my answer was yes. Yes, it is, Senator Horn. It's for both. It's to help people quit smoking. It would be ideal for us if everyone were to quit smoking today. Now, I don't know where in the world we'd get the money to make up for it. In the long run, we'd save money. There's no doubt about it. If everyone quit smoking today, we'd be much better off in the future because of health care. But, friends, that ain't going to pay the car tax this year. And I'm telling you, we've got to do something this year.
And that's Senator Dean Kirby speaking on the floor about the tobacco tax increase. For you two in the Senate, what are your thoughts on the 49-cent increase?
Well, first of all, the purpose of the increase in tax is to discourage use, and I think we need to raise taxes on cigarettes to discourage use. I'm very disturbed that we're not also raising taxes on chewing tobacco, cigars, and something called moist snuff, which I understand is real popular. I think it really is most unfortunate that there's not a raise on those items also. But as far as the budget situation is concerned, I could not be more distressed about what's going on with the most recent round of budget cuts that the governor's made. In my opinion, that is exactly the wrong thing to do. It exacerbates a bad situation. It's making the economic situation worse. And the last thing we need to be doing is talking about budget cuts at the state level. What we need to be doing right now is maintaining the existing level of appropriations for the rest of this fiscal year, and we need a budget for the upcoming fiscal year at about the same level we are now. We don't need to be telling school districts, who are the most underfunded school districts in the nation, that we're going to cut back. Children need educating this year and next year just like they did before. We don't need to be cutting back on Medicare and Medicaid. The economic effect of cutting back in those areas is counterproductive, even if you didn't take into account the health care tragedies that would occur. What we need to be doing is assuring the cities and the counties and the schools that they will have a level of funding just like they were promised in the legislation last year and the budget that's coming up. These are the possible ways you can get money. Number one, we have a rainy day fund with a couple $100 million in it. The governor, with the stroke of a pen, could put $50 million from the rainy day fund into the general fund right now. He's chosen not to do that. I think that was a mistake. We have a couple of $100 million in a health care trust fund. However good that idea may have been, it just hasn't worked out. That money's available for immediate expenditure. We have money that's going to come to us directly from the stimulus package. There's money that's going to come from Washington into the state general fund that we can use. There's money that's going to come as a result of the economic stimulus to help turn the economic situation around. The current budget cuts are counterproductive. They're the last thing we need to do. I could not be more exasperated that more people are not standing up and saying that this is just not the right course of action.
Looking at some of those things you talked about, increasing funding, they haven't happened yet. With the 49-cent tobacco tax increase, would you have liked to see it go higher than that to possibly help fund some of those programs?
I would like to see a higher tax than 49 cents a pack because I want to discourage people from using cigarettes. I think there's going to be a positive revenue effect from the tobacco tax increase, particularly if we will include chewing tobacco and cigars, which are not getting an increase right now for reasons that totally escape me. But you've got the following things that are taking place. Number one, there's a federal increase, what, 60-something cents that's going to impact.
Touch on that.
You've got the reduced sales because of the increase in sales. You've got the effect of some hoarding that will take place because there's an increase, and you've got some effect of people moving purchases from Mississippi to other states. There's so many moving parts, I don't know how you can predict with any certainty how much the revenue increase will be. I think the only thing you can do is put the bill into effect and wait and see what happens after all those various moving parts play out. but we need to do it very quickly, and we need to do it in a large amount.
And to you two in the House, just talking about some of the concerns with raising the tobacco tax, how does this differ from what they've done in the Senate with what you're considering in the House?
Well, we passed 82 cents in the House for a total of $1 on a pack of cigarettes, and we really didn't think that was that conservative, if you want to know the truth, but it's what we had the votes to do. You know, we're in a year, I'm not going to disagree with my very own personal senator at all. We're in a year where we need to maintain the budget, not grow it, but try to maintain the budget, because it is stimulus in itself. And to cut it is only asking for trouble, I think, on down the road. Now, you know, it's time to invite conference and try to sit down and see if there's some middle ground. I think 60-something cents would be mid-range. I can't remember the figure for all the contiguous states to Mississippi, and maybe that's what the ultimate compromise needs to be. But now I would say, along with also my senator, the distinguished chairman, man, you need all kinds of chewing tobacco and snuff and everything else. And then, Lord have mercy, we need alcohol. And if you really want to raise some money for a state budget, put Coca-Colas in there. Hello?
What about, go ahead, Representative Dito.
I just wanted to touch on a couple of things. The reason that we find a shortfall, especially in maintaining the budget, is in years past we have used a lot of one-time money to put the budget together. At the end of the year, the budget was balanced, but we didn't have a revenue stream that annually would generate the funds to maintain the budget. And so, in absence of those one-time funds recurring, we find ourselves in this situation. Also, I want to touch on something that Senator Bryan touched on, and that is we have to be careful that the solutions that we come up with do not actually cause other problems. For instance, if we were to cut institutions of higher learning salaries, or for instance, we could lose our faculty to other states, and after the recession was over, then we would have to start from scratch to rebuild our faculty in our universities. If we cut certain areas in health care, people who ordinarily wouldn't get that routine type of health care would show up again in the emergency room with problems that are much further advanced at a higher cost to hospitals than had we treated them earlier. And so certain solutions could cost us more in the long run, and that's the balance that we try to find when we make these decisions.
And we've got a caller here, Jean from Prentice. Go ahead. Jean from Prentice, are you there?
Yes.
Go ahead with your question.
Yes, I was wondering why our senior citizens, and such as myself, we only qualify for like $10 or $12 a month for food stamps when we've already paid our taxes, our dues to society, and we're still paying the high prices of food, electricity, just the necessary monthly things, and you don't have that much left for groceries, but yet you don't qualify for more than $10 or $12.
I think we've got it, Gene. For you two in the House, is that something that either of you deal with, the availability of food stamps?
It's federal. Food stamp program is a federal program, and it's a program that's based on income as a percentage of the federal poverty level, and when you're over that income, you're just over it. I mean, it doesn't seem right, Gene, and it doesn't seem fair, but food stamps are a big item in this state, and they generate a lot of economy in this state, and more especially provide a lot of food for a lot of people in this state. But we don't have a heck of a lot to do with that. The federal government runs, we administer the food stamp program, but the federal government sets the parameters.
Getting back to an issue we were just touching on a minute ago, the cigarette tax, the other part of the issue, as we were talking about, was where is that money going to go? We have some tape of Senator Dean Kirby speaking on the Senate floor about where the Senate decided that money should go.
And you need to talk to your supervisors before you vote against this bill. I'm going to tell you, because Rankin County alone will lose approximately $2.1 million that we're going to have to pass on to the taxpayers if this bill doesn't pass. $2.1 million. Now, I'm telling you, if you think people are mad at you over your property taxes, get ready on your car tags. Because, I mean, I've seen that dog hunt before, and I'm telling you, they get really fired up. Everyone doesn't own a home, but most everyone does own a car. Most everyone owns more than one car. Now, the people that don't smoke are really going to benefit out of this because they're not having to pay that tax, and they're still going to get their credit on the car tags.
That's Senator Dean Kirby speaking on the House floor about what the Senate just passed regarding increasing the state's tobacco taxes. What were some of the other options that you were considering? For you, Senator Hobson, what were you thinking for this possible increase?
Well, frankly, Stephen, I wanted to see all the money go into the general fund. I think that we, as legislators, have an obligation to fund the programs and all the agencies, and you know, we've talked about so many of the needs that we've got in our state. Rather than dedicating it to one specific cause, I'd rather seen it go in the general fund. I know a lot of my colleagues in the Senate think that there's some that say that it should go to Medicaid. I'm sorry, should go to education. There's some that say it should go to helping the hospitals pay for Medicaid. There's some that say it should go to the car tag fund. Frankly, you know, I feel like you put it in the general fund, and then we work off of that, those numbers, and then we can decide where it goes. But I'm not totally adverse to it going, some portion of it going to the car tags. I would have liked to, let me comment on what you asked earlier about the tax itself. I would have liked to have seen it be a little bit higher. I live in one of those border counties. Warren County, Vicksburg would see probably a great reduction of sales, and I'd like to discourage it, like Senator Bryan said, but I would hate to see all of the people in Vicksburg and Warren County continuing to smoke, going across to Delta, Louisiana to buy their cigarettes. So there is a line where it is. I can't say there is a line. There's a demarcation point where if you price it too high, you're going to lose people across the state lines, and I think that happened in Tennessee a couple of years ago, and the people from Tennessee came back to Mississippi to buy their cigarettes, but yet they continue to go back to their state and smoke the cigarettes.
And what about in the House? They were eventually decided to put that money in the general fund, with eventually some of that going to MAEP. Is that correct?
Let me talk about that, because it's something that Senator Kirby had touched on in his speech in the clip that we just saw. If we do not fund the Adequate Education Act on the state level, that cost is shifted to local authorities. The local school districts would very likely have to raise local ad valorem taxes to pay for the operation of the school district to replace the state funds if we don't provide those funds. For instance, they're bound by student-teacher ratios. That's the law. They have to have a certain number of teachers in the classroom for a certain number of students. Also, they already are in contracts on bus drivers and teachers, and their utility costs are fixed. And so if we do not have the revenue come into the school districts from the state, that burden would be shifted to the local level.
Representative Dido and Senator Hobson are exactly right. The bottom line is this: there are a number of ways that the state collects revenue and sends it to cities, counties, and school districts. One of the programs is a program to hold down the cost of car tags. That is short of money. We obviously need to continue that money flowing. We don't need to increase everyone's car tags right now. The schools rely on the Adequate Education Program as the basis for every budget in the state. We don't need to pass our budgetary problems on to the schools and exacerbate their problems. We've got homestead exemption refunds and other programs going to cities and counties. The message that needs to be going to the cities, the counties, and the schools is the money you're entitled to from the state is going to be there. We need to figure out a way to do it. Now, the tobacco tax has nothing to do with any of those things, in my opinion. But that's okay. If you want to earmark it for thing 1, thing 2, or thing 3, it really doesn't matter. All of these propositions need to be funded, and they need to be funded regardless of the outcome of the tobacco tax, which, by the way, we need to enact. We need to enact quickly, and we need to enact in a high amount.
We've got a caller on the phone. Calvert from Vicksburg. Go ahead.
Hi.
Go ahead with your question.
Yes. Do you support or oppose legislation to require all nursing homes to be insured?
That is a question. This is now the 3rd week in a row we have had that question. Maybe this is the most appropriate week with members of the health committees. What do you think, Representative Holland? Have you heard anything about this?
Well, we've heard a little bit about it, and there was a bill in our committee, and I sent it out to a subcommittee, and we looked at it carefully, and of course the nursing home industry does not think so. There are others who deal with some of the calamities that happen from time to time in nursing homes that think that it should be insured. But the bill did not advance this time, and I think that probably the thing to do at this point, because it seems to be coming each year. Nursing homes tell me they have a certain amount of insurance, but it's not enough. We probably need to look pretty seriously at that next year and try to figure out where the middle ground is on that and move on it.
Is this something that the Senate Health Committee would also be considering, you think, Senator Bryan?
I'm surprised to learn nursing homes don't have adequate insurance. It's something I'd be interested in knowing more about, but I'm not an expert on that area.
Getting back to something we were just talking about, we've got an email here from John who says, why is the Senate not willing to do the right thing in spite of the governor's wishes and raise the tobacco tax to $1? Sounds like John would like to see a larger increase. Was there some support, you think, in the Senate for an increase of that size?
There was some support. It was a pretty close vote on the amendment that was made to raise the tax to $1. There are two comments. One is that I know there's some reluctance because if we passed out a high cigarette tax and the governor vetoes it, there probably are not enough votes in the Senate to override the governor's veto. So in effect, you may end up with no cigarette. If you get greedy, and I don't mean to say $1 is greedy, but if you get too greedy, you may in effect have no cigarette tax increase. And I think there's no one here that would want that to happen. The second part is what I said earlier. If you tax it too high, and believe me, I would like to see it higher than what we had in the Senate, but if you tax it too high, you're going to have people running across the state borders and buying their cigarettes and coming back to Mississippi, particularly in a place like Vicksburg where I live.
We've got another caller on the phone. Lisa from Jackson, go ahead.
Yes, hi. This is Lisa Bell in Jackson, Mississippi. I just want to say thank you, Representative Holland, and the other representatives I failed to remember your name, about pushing or speaking on behalf of the educational system as well as the health care. That's a no-brainer. Those are two areas we definitely don't need to cut. Actually, I would like you to revisit and look at the CHIP program. From my understanding, it ends at age 19. There's a gap between that and, for the Medicaid for older people. So the college-age kids, those in post-secondary education, are going uninsured. And so therefore, yes, we bring them to adults, being healthy, but then through that post-secondary education level, they're left uninsured. I wish you all would revisit that and see what we can do for those young folks, because we want healthy, education, healthy equal healthy communities. And also,
I think we've got it, Lisa. What can we do for the people in that age group?
I could be wrong, but I believe that the federal government stops it at 18. Is that, or 19?
No, I think that's our call. I think that's our call, and I think what we'll do, Ms. Bell, and thank you for your compliments, but we've got the SCHIP code before us, and of course it's obvious it's been signed now by the president, so there's going to be some very strong renewed interest in SCHIP and what it does for our children, and I think you'll see us before this session's over completely revisit that program, not only from the perspective of limitations, ages, etc., but how we will administer that program and how we will look to outreach better, and with the only goal being serving all the children that we possibly can so that they'll be healthy children.
I might add that our state's match is only about 17%. The federal government puts up the other 83% for our cost of the CHIP program.
But for you, Senator Bryan, is there anything we can do for these people, as the caller was mentioning, that kind of fall in this middle ground when they are in the sort of the college years?
Well, I'm perplexed that the caller gave Steve and Dirk credit for speaking out in favor of funding public education and health. I thought I'd been holding up my end of that fairly well tonight.
Ms. Bell, Senator Bryan's been a great friend of SCHIP.
In all seriousness, what we need to do is take advantage of everything we can do under Medicaid and SCHIP, because our state match is so low that it costs the state very little. If you look at the economic activity that's caused in the state simply by having that additional money turn over in the state, there's an economic plus which helps make up for some of the state's share. But let me give you an example of something we've done which is completely counterproductive. And this happened several years ago. It happened before Senator Hobson got here, so he's not to blame for it at all. There was a piece of legislation passed to cut back the amount of money that doctors were receiving to see Medicaid patients by $24 million. Given the match, that saved the state $6 million. Well, the reimbursement levels for physicians who see Medicaid patients are low anyway. And we have taken $24 million out of that stream in order to save $6 million for the state. That's just an incredibly counterproductive thing to do, and we need to be doing the exact opposite, in my opinion.
We've got an email here touching on something we were just talking about from Wayne, who says, what is the argument against extending the number of years between issuing new car tags? Also, how is it that private LLCs are allowed to have state government tags? And that's from Wayne. Was there any talk of doing something like this, extending the car tags, or is it mostly just about offsetting the car tags? Is that mainly what the Senate focuses on?
You know, the first I heard of this was about 2 weeks ago, no, less than 2 weeks ago. It was the day after our deadline for filing bills, and my local tax collector came up to me and said, we're wasting money by having a car tag reissued every 5 years. We ought to keep car tags until the person changes cars, and like other states, you can have different car tags. We have them right now with the specialty tags, and I thought it was a great idea. I'm sorry that I didn't think about it earlier, and I've told her to work with me to get some legislation proposed for next year, because I think that would save our state some money.
Getting back to an issue that relates a little bit more to health care here in Mississippi, it was reported last week that an attorney for the State Department of Mental Health is being provided free housing, and so are more than 130 others, including doctors, administrators, nurses, maintenance personnel, and dentists. With the funding crisis we're facing here and state agencies having their budget cuts, how do you view these sorts of perks that are being offered to people and sometimes costing hundreds of thousands of dollars to the state?
Well, we had about a 3.5-hour hearing in the House Public Health and Human Services Committee dealing with the Department of Mental Health, and we had everybody from psychologists to therapists to rank and file people, users of the system who came and I think really hashed out a lot of issues in the mental health field, and that's one of them. I think we have about 100+ houses that are furnished to various level of employees through the Department of Mental Health. Now, you got to remember, we run several institutions at the Department of Mental Health, 4 hospitals, several facilities, and it is pretty straightforward and even a matter of accreditation that somebody in administrative and therapy levels be very close to those facilities, because crises happen there pretty often. I don't know what we can live with and what we can do without, but let me tell you how we decided we're going to handle it. I think we had 13 bills in the House Public Health Committee changing the way that we deliver mental health services, or doing away with the houses, or putting a medical doctor at the state staff, or changing the board, or changing the executive director and so forth, and there may be issues with all of those. I'm a pretty big advocate of our state mental health system. It does have a lot of revolving door problems to where we treat and folks get out on the street and we don't have enough community-based services and they wind back up in the institutions, and it's just a vicious cycle and a tough problem. But I think Senator Bryan, and I hope Senator Bryan, he tells me he's warming up to it, is going to agree to this. We're going to give probably the most extensive look to the whole state mental health system that we've given in maybe 20 years in this upcoming season when we get out of here. And I hope we come back in the 2010 session with a new blueprint for the delivery of mental health services in the state. The whole deal is we have spent 10 to 15 years on bricks and mortar. We've got some wonderful institutions. I can tell you, there are states all over this nation that come to the state of Mississippi to visit our mental health facilities because they're superb, our programs are superb, but the fact of the matter is we probably have not done enough to make it all through the state in all 82 counties in a community outreach, home and community-based waiver type situation. That is a priority of mine for the mental health department, and I'm going to work on it diligently, and I hope the Senate joins in that, and we will do more than yeoman's work to see what the real answers are. We'll take those hearings to people in all parts of the state, and I think we can come to some conclusions.
Senator Bryan, what's your response? What's your
there's several things going on, but to respond to the question that was first asked, you must understand that there are individuals who are severely limited in their abilities that are in state institutions. There are individuals who need around-the-clock care and fairly intensive care, and the delivery of those services requires a lot of people, because that's how we care for those who cannot care for themselves. And I think we can be proud in Mississippi of what we do for the people with developmental problems and others. For a poor state, I think we do a job that all citizens can be proud of. But part of that does require individuals to be present in these institutions where citizens are held. So the fact that someone is being provided housing so that he or she can be at that location in and of itself doesn't raise any alarms. There may be other situations we need to work at. But in response, Steve's right. He's about convinced me that we need to have a formal review of mental health. Of course, as Senator Hobson knows, we've been meeting this summer and talking about the mental health situation and indeed all the situations about health care. We have a lot of people in institutions. We are short on what we do to provide services for people in the communities, in community-based settings. We need to move in that direction. And the new head of the Department of Mental Health, Ed LeGrand, agrees with all of that. And Mr. LeGrand himself is one of the big proponents of Steve's idea that we have a rather formal study committee this summer. So I think it's very likely we're going to do that.
We've got a caller on the phone, Marvin from South Haven. Go ahead.
Yes, I was going to revisit something that y'all talked about earlier, some of the budgetary shortfalls and talking about raising taxes on cigarettes. And not that I'm opposed to that at all, but if you can't get all the money from there, they also said something maybe about going into some of the rainy day funds, which I am opposed to because I believe they're important. Where else would you go to get that money if not borrow? And as you can tell, the federal government has tried that, and it hasn't worked out so well. So what else could you do?
So we've got a concern here that there might not be a lot of options. What do you do in the House, then?
I would say that there are a lot of special fund agencies that operate off of the fees that they collect for certain inspections. In many cases, those agencies charge a fee for an inspection that costs more to deliver the inspection than it does to for the fee that they charge. And so the likely thing that would be considered would be to look at a lot of the smaller agencies and so that their fees would support their agency as opposed to using general fund monies to support the agency.
I'd like to...
well, first of all, is I read the good book. It says that in the 7 fat years, you're to store up for the 7 lean years. And when the 7 lean years get here, you're supposed to take the hay down out of the barn and feed the cattle. You're not supposed to sit around with your cattle starving to death bragging about how much hay you have in the barn. This is what a rainy day fund is for. Talk about a rainy day. This is the 1927 flood. And indeed, this is the time to move money from the rainy day fund so that we don't have to have these counterproductive cuts. Now, I'll say this on behalf of the legislature, which is really hard to imagine, but it's true. You could look it up, as someone said. Back several years ago, when we had better economic times, we did set aside money. We did establish the rainy day fund. We did, through a number of other devices, not spend all the money that was coming in because those were the fat years. And amazingly enough, the legislature had the self-restraint to do that. But these are unusual situations. We're all grown up. We know that, number one, that the wealth of the nation is produced basically by the free enterprise system and by those in the private sector. But we also know that there are economic cycles, and government is not a business. Government is not a family. Government can and should be countercyclical. And in these very unusual times where we are now, yes, indeed, we do need to reach into the rainy day fund. We need to reach into other areas we can get money and continue the basic core functions of state government, which are needed regardless of the economic situation.
I would like to go back to you, Representative Dito, for just a second. Being, of course, chair of the Medicaid committee, what's the situation facing Medicaid here in Mississippi this fiscal year?
I believe we need to find about $295 million to fully fund the agency. The budget last year included, again, a lot of one-time money and budget contingency funds. And so that's our challenge this year, and we'll be looking under a lot of rocks to find that.
So does that include then the $90 million deficit that was talked about so much last year, and then the remaining, does that just come from the falling tax revenues?
It's a combination. Last year, the Division of Medicaid figured out a recalculation on how they handle some of their dual eligible reimbursements, and $30 million, I believe, of that will carry forward into the next fiscal year, and so that will help a little bit.
Looking at the Medicaid agency, how can that agency absorb cuts? If there are more cuts made to the agency, what can they do? Can they reduce services? I mean, what's it within their power to do? Again,
and that goes back to some of those solutions might actually cause you more problems in the long run. If you cut back on some things that are routine medical type of exams, then the next thing you know, you have untreated patients who've developed acute illnesses that will cost much, much more to treat. And so we have to find that balance.
One thing that could obviously affect Medicaid is the possibility of a federal stimulus package. This week, Governor Haley Barbour spoke out about his concerns over strings attached to federal stimulus money, which could be more than $2 billion here from Mississippi. Let's hear what he had to say.
So I will be very careful to look at whether we're going to take a year and a half's worth of money and then have to change public policy to suit Nancy Pelosi for the rest of our lives. I think prudence dictates that we look before we leap. I will say, I suspect that most of the money will either have strings that are attached that are insignificant or that are manageable. But there's some that may not. And if I consider them to be against the best interests of the state, then I'll oppose our accepting the money. Hopefully the Senate will clean a lot of this up.
That's the governor talking about concerns over a stimulus package. In the Senate, what are you two looking at in the stimulus package? What are some of the possibilities here in Mississippi?
Frankly, I haven't had a lot of time to look at it. We've been so busy in the Senate. We haven't been, at least I haven't had the time to pay much attention to what the federal government's doing. I will say this. I agree with the governor about the strings attached. I want to see what the proposals are from the federal government before we jump in and say absolutely we want the money. I'm concerned on the Senate side. We, in appropriations, and I'm on the appropriations committee yesterday, killed the only bill, the only vehicle that I'm aware of in the Senate that would allow us to fund Medicaid. And I don't think any of us in the legislature want to not fund Medicaid this year. I don't know what the House has passed. I don't know what's coming our way from the House, but we've got some work to do because I'm not aware of any bill that we have available. I know the concerns that a lot of members of the Senate had with the proposed bill, and that was that it would be a hospital assessment or hospital tax, if you want to call it that. But the problem is we don't have any vehicle to fund Medicaid right now, and we're going to have to do something. I'm not sure what. I don't know if it's going to be a House bill or a special session, but something to fund Medicaid, or we'll really have a ride at the Capitol.
You know, I was bemused at the governor, bless his heart, mentioning Nancy Pelosi's name. And did you notice how many syllables he got out of Nancy Pelosi? He had like 6 or 7 syllables the way he said. Briggs, my good friend Briggs is of the Republican faith. Do you get the memo to say Nancy Pelosi's name repeatedly?
We're working on Barack Obama right now.
I think you know for the longest it was Teddy Kennedy that was the scary figure, and I think they're trying real hard to give Nancy Pelosi a run.
But getting back to what he was saying, what are some of the strings that you're considering?
Well, I think the governor did have a point, and in the United States Senate, I think the bill is ultimately going to be improved, and I think the final package is going to be very good. I think it is appropriate in situations like this for people to work in a bipartisan manner and take into account the views of all concerned. I'm pleased to see some of that taking place in the United States Senate. But at the end of the day, we need the money.
And for you two, we're running short on time here, but what are you watching in the stimulus package?
Senator Travis Childers, Representative Travis Childers, Representative Benny Thompson, Representative Gene Taylor are not stool pigeons. They have carefully reviewed this plan. The bottom line is the state of Mississippi is the poorest state in the United States of America. This stimulus, from what I've studied, is going to benefit us just like most federal programs do, much more than it's going to benefit California or Texas or New York State on a per capita basis. Strings, we'll look at them, but to say that we may not take them because of the strings as being pretty short-sighted as far as I'm concerned. I am looking forward to the United States Senate passing that stimulus plan. I am looking forward to meshing those programs in with our state programs, and I am looking forward to the quality of life of all of our citizens improving because of this policy.
And Representative Dito, how would this possibly affect Medicaid in Mississippi?
The primary fact that is contemplated in the federal package is the fact that unemployment is rising. Right now in Mississippi, a quarter of our counties have double-digit unemployment. That economic situation puts upward pressure on the Medicaid rolls. The fact is we're going to have more people who are eligible for the program. The fact is that we are going to need the extra help from Washington to be able to meet that need.
Of course, I hate to interrupt you there, but we're out of time. This is obviously an issue we'll have to deal with more. I'd like to thank our guests, Senator Hob Bryan and Briggs Hobson, Representative Dirk Dito, and Steve Holland. I'm Stephen Caranda. Good night.